Hello, everyone. I'm Amy.
And I'm Joey, and we did our population health data analysis on South Africa.
This is just a map with reference to where South Africa is, just for you, if you didn't know where South Africa was.
So some of the main causes that we found of premature death in 1990 were diarrheal diseases, lower respiratory infections, and tuberculosis. And these changed like a lot throughout the years.
Mhm. So here are the three causes of premature death that led to the largest number of years of life lost for 1990 and 2010. So in 1990, you see that the first one was diarrheal diseases, the second one, lower respiratory infections, and the third, interpersonal violence. And then this changed in 2010 to the first being HIV/AIDS, number two being diarrheal diseases, and number three being interpersonal violence. So here you see some numbers that have increased, some trends. The non-percentages are years of life lost in thousands. So some inclines that we saw in the data included the years of life lost due to HIV/AIDS, which increased from 223,000 to 11,201,000. And then hypertensive heart disease also increased from 112,000 to 213,000. And then we saw that drug use disorders increased by 2,079%, which are all pretty significant increases.
Yeah, definitely. So some of the declines that Amy and I were able to see between the years 1990 and 2010 were congenital abnormalities, which went from about 271,000 to 179,000. And then also we saw decreases in protein energy malnutrition, and communicable diseases such as syphilis and measles actually decreased in mortality.
Okay, so now we're going to talk about the changes in the top conditions that occurred and why these might have happened. So the first is HIV/AIDS. So this increased by 4,962%, which is pretty significant. So we were trying to figure out why this number jumped so much. So we looked at the history of HIV in South Africa. And, the first case of HIV wasn't seen until 1982. So over time, it makes sense that the numbers increased. Additionally, though, in autumn of 2009, the president of South Africa publicized a commitment to test all children exposed to HIV. So this initiative may have contributed to higher numbers in the next year, along with other initiatives explaining the increase.
So moving forward, we actually saw a 20% decrease in diarrheal diseases between the years 1990 and 2000. Factors such as increased immunizations, overall better access to healthcare, improvements in water sanitation, and other socioeconomic changes actually affected the spread and mortality of diarrheal disease, leading to this decrease.
And then we see that interpersonal violence increased by 32%. So a source that I found talked about how accurately measuring the exposure to violence is pretty challenging. So this increase may just be attributed to inconsistent reporting.
And then we then saw another decrease in lower respiratory infections. And it was actually very interesting to read that low cost housing across South Africa actually led to an increase of lower respiratory infections due to the fact that many of the houses were poorly maintained with insufficient structuring. The article mentioned in our references down at the bottom by Christina McKenney stated that wood and cardboard were commonly used materials within households. And then also stated in the article, they said that environmental factors such as chemical exposure, inadequate housing ventilation, and overcrowding made it extremely likely that household members would contract lower respiratory diseases. And then due to, this is an assumption or a suggestion, that maybe due to increased measures to support infrastructure, South Africa then actually saw a 20% decrease in lower respiratory disease.
Mhm. And so then moving on to tuberculosis, we see that 15% increase. So the National Department of Health attributes this to problems with unique identifiers for patients, kind of like an ID issue. And then other scholars say that it could be due to changes in counting. So on to the next slide.
So for the next slide, I'm talking about age range incidence for the top 5 leading causes of YLDs in the year 2010. YLDs being years living with disability. So some of the highest mentioned in HIV and AIDS was between the years of 25 to 49, some of the lowest being years 0 to 1 and 75 to 80 plus. We also see major depressive disorder with the highest being 25 years of age to 39 and lowest being 0 to 4 years of age. Lower back pain is another significant one, with the highest ages being 25 to 34 and the lowest being 0 to 4 years of age. Iron deficiency, also pretty prevalent, with highest 1 to 9 years and a little jump in between, and it jumps to 25 to 39 years, with the lowest being 0 to 27 days of age, and then 75 years to 80 plus. And lastly, COPD with highest being 25 to 39 years of age and 0 to 1 years.
So as you may be able to tell, the age ranges for each are pretty similar. And so we really think this is because ages 25 to 29 are considered like the healthiest and most resilient ages, as opposed to infant and geriatric populations, which are the most vulnerable to all of the conditions that really impact people the most in South Africa.
Okay, moving forward, the top 3 causes of DALYs or disability adjusted life years were HIV and AIDS, and diarrheal diseases, which are both communicable diseases, and interpersonal violence, which falls under the injury category. And then some of the biggest increases in DALYs were HIV and AIDS, based on previously discussed material and conversation on how its prevalence was so widespread throughout this time. We actually ended up seeing a 200% increase. And that was tied with drug use disorder, which during the time may have seen a large increase due to many factors like socioeconomic problems, and actually accessibility most likely increased as well to these drugs. And then decreases as well. One of the largest decreases we found were congenital abnormalities, which decreased around 30%, which may be due to increased knowledge of maternal and newborn health. Okay,
so here we have the risk factors that are associated with disability adjusted life years. So for HIV/AIDS, you see risk factors being alcohol, high fasting plasma glucose, and smoking. And then for diarrheal diseases, we see suboptimal breastfeeding, children being underweight, household air pollution, and then for interpersonal violence, we see alcohol use and intimate partner violence. And here are our references. So thank you so much for your time.